and welcome to our nursing career panel. On behalf of the Saskatoon Industry Education Council, I'd like to welcome you to our Career Pathways panel. We acknowledge we are on Treaty 6 territory and homeland of the Métis. We would like to welcome students, parents, and teachers from across Saskatchewan joining us. For the past 2 decades, the Saskatoon Industry Education Council has bridged the gap between Saskatchewan's school systems and employers, providing experiential learning and career development opportunities for Saskatoon and area youth. As a registered nonprofit organization, the SIEC works in partnership with 3 school divisions and the Saskatoon Tribal Council, as well as community-based organizations, government agencies, and employers to help nurture the workforce of tomorrow. Last year, we worked with over 29,000 youth, over 1,300 businesses and post-secondary representatives, and more than 600 educators and career practitioners. The SIEC hosts over 40 events and programs each year, including events like this, our Spotlight on Careers, which are a series of targeted events providing students with experiential learning opportunities, Skills Boot Camps, which provide students with hands-on experience in various career pathways, Connected, a women mentorship program connecting females in grade 10 through 12 with mentors from a wide variety of sectors in Saskatoon, as well as the Summer Youth Internship Program, which is a 6-week paid internship where students gain work experience in construction, manufacturing, automotive, IT, and they can earn competitive wages and high school credits all during the summer. Please visit our website, saskatooniec.ca, or follow us on our socials to stay up to date on our program offerings. At the SIEC, we feel it's just as important to find out what you do not want to do as it is to discover what you do want to do as a career. So if you're not sure what you want to do after high school, we highly recommend that you attend a few of our events to discover what is involved in various career options. Thank you to our panel volunteers who are here tonight sharing their career journeys with us. Thank you to the post-secondary representatives who will share important details about applying for their programs. And we'd like to encourage everyone to use the Q&A function in Zoom. If you have any questions for any of the panelists, or if you have a question, a general question, please put it in there and we'll be sure to address it throughout the evening. So we're going to get started with our panel. First up, we are going to have a representative from the Saskatchewan Health Authority with us. Lauren Garner has been working with SHA for 5 years. She is currently a workforce planning and employment specialist and supports acute care, Saskatoon, and health information management and privacy. Since its inception, Lauren has been involved in the nursing panel and is excited to speak to you about the Saskatchewan Health Authority. So please welcome Lauren Garner.
Thank you, Michelle, and good evening, everybody. Welcome to the 2020 Nursing Panel. Part of my role in workforce planning and employment with the Saskatchewan Health Authority is to recruit the next generation of healthcare workers. We are always excited to share information about the occupations in healthcare, and we hope that today helps you make an informed decision about your career path. We are so grateful to our presenters who are taking their personal time to share information about their nursing careers with you. I want to tell you a little bit about the Saskatchewan Health Authority. We employ approximately 44,000 people in a wide range of occupations to care for the people of Saskatchewan. It is important that we have strong interprofessional teams working together in order to have healthy people and a healthy Saskatchewan. Of our teams, the largest occupational group is nursing. I know we have some people from around the province joining us today, which is fantastic news, and one of the benefits of having this presentation virtually. However, as Michelle mentioned, I am from Saskatoon, so the following information regarding the specific numbers of people that we employ in each classification is specific for the former Saskatoon Health Region. The first group I wanted to talk about is continuing care aides, or CCAs. We don't have any CCAs on the panel this evening, but we do employ 2,500 CCAs. Their starting wage today is $21.61. Continuing care aides do exactly what it sounds like. They aid in the care of our patients. They help mobilize, dress, feed, and bathe our patients. And we often have LPN and RN students work as CCAs while they're in school. The next group are licensed practical nurses, or LPNs. We employ approximately 820 LPNs in the former Saskatoon Health Region. Their starting wage today is $33.73. They work in areas like long-term care and in hospital, but won't work in the more acute areas like ICU or critical care. And then the last group is our registered nurses. In former Saskatoon, we employed 3,200 RNs, and their starting wage today is $35.99. RNs work in all facilities across the continuum of care, including our most acute areas in ICU and critical care. The Saskatchewan Health Authority is a unionized employer, which means there are specific rules beyond labor law that govern the employment of our staff. The foundations for our unions is seniority, which drives selection for employment and the hours to be picked up for work. It also creates standardization across the authority in terms of wage and benefits. There's always something new going on in healthcare, whether it be opening a new hospital or handling a global pandemic. So there's constant demand for workers, which means good job security, as well as very competitive wages and benefits. There's also so many different streams and opportunities within healthcare that our panelists are going to highlight for you tonight. Thank you so much.
Thank you, Lauren, for bringing greetings from SHA and providing us with that information. We'll now move on to the next portion of our event, which is where we will hear from the post-secondary representatives joining us tonight. First up, we have Trudy Unger. She has been a student advisor with the College of Nursing, University of Saskatchewan since 2004. She works with both prospective and BSN students to support success. As part of her role, Trudy is an advisor for the U of S community of Aboriginal nursing and works with over 80 Indigenous BSN students at Saskatoon's main campus. She also advises Husky athlete students, and Trudy has 3 children, 4 grandchildren, and 1 very needy but lovable cat. So please welcome Trudy Unger.
Hello, good evening, everybody. Thank you so much, Michelle, for that introduction. Thank you for mentioning my cat, who sometimes does come and creep at my computer. So if you see the cat, just ignore it. I'm here tonight to be able to share about our University of Saskatchewan College of Nursing program. And I'm just going to talk for a little while about the pathway into nursing at the U of S. And I see in the chat we've already had one person ask a question about the difference between the U of S and U of R programs. So the U of S College of Nursing program is not a direct entry program. It starts with a year of pre-professional study, typically taken in the College of Arts and Science. It can also be taken at the University of Regina, Arts or Science, other institutions, community colleges. So students will go from high school into the College of Arts and Science or a similar type of institution, and they will do 30 credit units of pre-professional study, fairly general but prescribed classes. Those are things like chemistry and biology, statistics, nutrition, English, Indigenous studies, and some social sciences, open electives. You can find all of that information on our website. So I guess the main thing to really emphasize is that it is a kind of a laddered approach coming into the College of Nursing. So you come from high school into College of Arts and Science, and then you apply to the College of Nursing for the 3 additional years of your 4-year degree. At the high school level, it's important for you to take certain classes so that you will have the prerequisites that you need for pre-professional year classes. So courses like English, A and B 30, chemistry 30, biology 30, foundations of math 30, or pre-calculus 30. So those are the ones that are really important for you to have. And that's not so much for nursing, but it is for the arts and science courses that you'll need. And in the year that you would be finishing up your pre-professional courses, you would be applying to the College of Nursing prior to March 31st for admission there. It is one application form, and you can rank your admission sites in order of preference for the University of Saskatchewan, provincial nursing program. So the whole U of S program is available across the province in Saskatoon, in Regina. It's also available in Prince Albert, in Yorkton, in Isle of Cross, and in La Ronge. And so one application fee, but you can rank your sites in order of preference, and you will be considered for each of those sites according to the admission criteria. So again, non-direct entry, laddered approach. The pre-professional year, I think, is a really valuable year for a lot of people. I think students have to kind of look at both nursing programs to see which pathway suits them or fits them best. Both programs are great, both have similar clinical hours and experiences, both lead to the same goal in the end. Pre-professional year can be, for some students, a great way to just really get a solid foundation started at the post-secondary level, rather than going directly from high school into a professional program. It's nice to be able to come and just start at that arts and science level and then move up from there to that professional college level. It also gives an opportunity to go other directions if you want to. So I was just thinking today about a conversation I had with a student who emailed, and the student came into arts and science, took particular classes thinking that they might head toward pharmacy, and realized partway through that they really want to do nursing. And so the courses they've taken are not a loss to them, but are, great. They can move this direction instead, and they can apply to nursing for this upcoming fall. So pre-professional year can give you the opportunity to go some different directions. If you're not quite sure where you're headed, you have kind of some ideas. It's a good way to just kind of start building a foundation and then also explore some things at the same time, especially if you're looking at various health science areas. So high school into pre-professional year, into applying to the College of Nursing. You can, if you would like to, do pre-professional year over more than 1 year, which is, again, something positive for some students. Take it a little easier, take maybe 3 classes, 4 classes, and in your second year, maybe take some classes toward nursing that can be used as transfer credit. So it just depends on what you yourself find that you would like to do best. One of the things that I really would like to emphasize tonight is that our admission criteria to nursing is changing as of the fall of 2021. So up to this point in time, your admission to nursing was based strictly on 100% your marks in pre-professional year. And that will no longer be the case coming up in fall of 2021. So we will have 60% of your admission score based on your overall average in pre-professional year. 40% of your admission score is going to come from a test of situational judgment. And the one that we've chosen currently is called CASPER. And you can find out more information about that on our website, or you can go to takecasper.ca and take a look at it there. But it's a test of situational judgment means that we're looking at qualities that are not just being able to take exams, but looking at ways that students critically think about situations, how they think about things ethically, how they process through situations. So I think that's going to be a really positive thing for students. It's going to bring out some really great qualities as students move into the nursing profession. So just be aware of that if you're looking at things for the future, that there will be that additional admission criteria, and you will have to do that. That will be part of our admissions things that are due by our documents deadline every year. So I just wanted to mention that new change for us. I don't have too much more to say. I'm just looking at the questions along the side. Can your pre-professional year be with any degree? Maybe, not necessarily. I would say get a hold of an advisor if you have any questions about how your courses would transfer toward pre-professional year. We often do get students who have some post-secondary and are wondering how that goes toward pre-professional year. And it's not just completing the courses, but also completing the courses with a good, robust, healthy admission average, overall admission average. So we can take a look at that with you and just look at how the courses meet the requirements. What is your average looking like? What are the things that you might want to adjust a little bit? And happy to talk with anybody about that and provide advisement there. I just want to say that the nursing program, the U of S nursing program across the province is fairly similar in all of its sites. We try to provide the same type of programming. So, you know, don't be afraid to try out some of the other sites as long as you can go there and you know, have the supports in place that you need, because I think each one has its own flavor, but each one is a great place to be. So don't be afraid to do that. I think that's all I have to share. Michelle, thank you very much. I don't know if anybody else has any questions, but I'm also available for questions at the end as well.
All right. Thank you so much, Trudy. We do have one question that we could quickly address.
Sure.
It says, can you take the College of Arts and Science pre-professional year, and if I decide to get into med school instead of nursing, can I get into biomedical sciences after my pre-professional year, and would it count as a 4-year degree?
I would say likely. Again, you'd have to look at the courses that would go toward that. So it might not be identical in what is needed for a first year for biomedical sciences versus a first year for nursing pre-professional year requirements. You'd have to look at all the courses, but I would say likely many of them, if not all of them, would transfer and could be used for various areas. And I also see a question that says, we take the CASPER in our first year. You take it in the year that you would be applying to nursing. So you would do that prior to June 1st for the fall that you would be coming into nursing, that you've applied to come into nursing. So yes, I guess that would be in the first year. You're welcome.
All right. So if there are any more questions for Trudy, her and Sheena, our next presenter, will take some question and answers once Sheena's done her presentation. So be sure to put them in the chat. And you can specify if the question is for the U of S, for the U of R or SAS Poly programs, or if it's just a general question. All right. Next up, we have Sheena Kabatoff. She is the Office Administration at the Saskatchewan Collaborative Bachelor of Science in Nursing program and is employed by the Saskatchewan Polytechnic. She has worked in adult education and healthcare for the last 15 years, with the last 6 being with the SCBSN program. One of her favorite things to do in her role is to participate in career fairs like this one. You will likely see her at other career exploration events around the city, and in typical years, she's usually at all of the different city career fairs. Please welcome Sheena, who will speak to both the registered nurse and licensed practical nurse programs at Saskatchewan Polytechnic.
Thanks, Michelle. Welcome everybody to this event. This is one of my favorite events. I wish that we were in person because these presentations are so much better in person, but that's all right. So I am speaking on behalf of 2 different programs, the SCBSN program, which is the program that I work for, and the practical nurse program that is also available here in Saskatoon. All right, so the SCBSN program is a collaborative program between the University of Regina and Saskatchewan Polytechnic. So your classes are taken in Saskatoon at Saskatchewan Polytechnic, but your degree is granted by the University of Regina. And you do get the same Bachelor of Science in Nursing degree that you would get at the U of S. So the program is delivered in Saskatoon, Regina, and North Battleford. It is competitive entry, so how we determine who gets into the program is strictly based on your high school marks. And one of the differences between the SCBSN program and the BSCN program at the College of Nursing at the U of S is we do that pre-professional year throughout your program. And we do start doing nursing hands-on clinical practices in first year. So there are 150 seats in Saskatoon and 187 seats in Regina. The program is accredited by CAUSN, which is the Canadian Association of Schools of Nursing. We do have state-of-the-art simulation labs that allow you to practice your skills hands-on in a safe environment before going and practicing on real patients. Practice education in every semester. So what practice education is actual clinical placement. So in every single semester, you will have a different clinical placement throughout the city. Another difference between our program and the U of S program is we have fast track options. So your regular degree is a 4-year degree, but we have options to take classes in 1 or 2 summers to have you finish in August or December. And Lauren will attest that the health region likes when the graduates come out in August and December, because they don't just have positions to fill in April when everybody else graduates. So should you take one of those options, you have a smaller amount of people that you will be competing for positions within the health region. So here are your high school requirements that you have to get into the program. So English A30, B30, Foundations, Math, or Pre-Calculus. You don't need both, and we will take the higher of the 2. Bio 30 and Chemistry 30. It does say that you are required to have 70% in each of the required courses. However, being competitive, we want to see those grades as high as possible. Last year's average for grade 12 students coming in was 92. So how to apply to the program. Applications are open right now. However, Sask Polytech is we're under a cybersecurity event. So right now you can't apply, but you have until February 15th to apply. I'm assuming that might even be extended, but just check the website. We do need to receive your transcripts, your first semester transcripts by March 1st, and then your final transcripts by August 1st. And acceptance emails start coming in spring of 2021. So you can apply online or in paper, but I assume that you will all apply online at sasknursingdegree.ca. So this is just a rundown of money stuff, because this is what parents want to know for sure. Approximately $8,000 a year in tuition, books, uniforms, and other supplies. So $2,000 for the first year, and then about $1,000 each additional year. I mean, if you're going to take care of your uniform and your textbooks and your shoes and stethoscope, well, then you won't have to replace those, but there might be additional costs throughout the program. An electronic mobile device or a smartphone is used. Our students have a number of apps that they use to do clinical research. We do also have a faculty member who has created a program that allows faculty and students to communicate in real time about how they're doing in the clinical setting. And the good thing about being a collaborative program is you can apply for scholarships and awards from both institutions, U of R and Sask Polytech. So if you have any questions, you can visit our website at sasknursingdegree.ca. And yeah, if you have any questions, I'll be here to answer them. Okay, so that was the first one. This second one is for the practical nursing program. So at Saskatchewan Polytechnic, we actually have 18 different nursing programs, but the 2 programs that high school students usually apply for are either practical nursing or registered nursing. We do also have the psychiatric nursing program offered in Prince Albert and in Regina. If that is of interest to you, I can send information on that program as well. So the practical nursing program prepares you to be eligible to become a licensed practical nurse in Saskatchewan. Practical nursing is accredited from SELPN, the Saskatchewan Association of Licensed Practical Nurses, and it does meet the Canadian Association of Licensed Practical Nurses national standards. Again, admission requirements are the same, are similar to the degree nursing program, English A30, B30, Foundations or Pre-Calculus, Social Studies, History or Native Studies 30, one of them, and 1 Bio 30, Chem 30, or Physics 30. There is an English language requirement, and if you need information on that, we can contact Sask Polytech to get you that information. This program is another high demand program. So unlike a lot of Sask Polytech programs, and this might be a question, it's not first qualified, first admitted, right? So it's not first come, first serve for applications. High demand programs are based on your marks. So the difference between the degree program and the practical nurse program is your admission is based on your high school average, but there's also an interview as well. So out of the 28 to 30 full-time seats in Saskatoon, they might accept 40 students and then interview some of them to choose out of the extra students which are actually going to be accepted into the program. There is an intake every fall. There is no coming in halfway through in January. It's every fall, and the SCBSEN program is the same. So I'm just going to play this little video for you guys. This video was made for the practical nursing program, but it is in our simulation learning center. So this is also the same area where you guys would be learning in the SCBSEN program as well. I'm just going to make sure, yeah, my computer sound is on.
Well, I like the small class size. I love the nursing instructors. They really helped guide me to become a successful practical nurse. The labs really helped transition me from being in the classroom setting to real-life scenarios in the healthcare settings.
All of our faculty have recent, relevant experience in the clinical environment. Our program is 68 weeks long, and of that, over half of it, the learning takes place in the lab and clinical environment. So there's certainly a strong theoretical component, but it's very hands-on as well.
The skills have been everywhere from hand washing to catheter insertion all the way to injections. So it's been great to work side by side. Real nurses that have been in that clinical setting, and this is their career. And even so with these skills, we've been also learning therapeutic relationships. So really getting competent in our nursing as well as doing well with our therapeutic relationships with our patients, which is also very important to be caring and competent.
The job opportunities available to students upon graduation are in long-term care, home care, acute medicine and surgery, and pediatrics in the obstetrics unit.
Well, the Saskatchewan Polytechnic students always come to us well prepared. They come with a good understanding of the work that's required, and we as an employer have the opportunity to provide input into changing trends in our environment. And so we do discuss with them what our requirements are in the workplace, and they try and match their program to make sure they're on top of keeping up with our needs.
The practical nursing program is really great. We have top-notch instructors and the greatest place to really vitalize our skills, and it's just, yeah, it's a great place to be.
I don't see any other questions right now in the Q&A or in the chat. So we can move on to our panelists, and then Sheena and Trudy will be here with us throughout the rest of the event. So if anyone does have questions, just put them in the Q&A and we will address them later on. So thank you very much, Sheena, for sharing information about both of the nursing programs that are available at Saskatchewan Polytechnic. So we will move on to our panelists who are joining us tonight. First up, we are going to hear from Lorna King. She has been nursing for 42 years after spending 6 years in the banking industry. She graduated in 1977 from Kelsey Institute when there was a 2-year RN program. Lorna is originally from Saskatoon, but has lived and worked as a nurse in 5 Canadian cities and 12 US cities as a travel nurse. Lorna loves to travel with her husband for vacations and has visited approximately 27 countries. So please help me join Lorna King.
Hi. As Michelle said, I've been a nurse for 42 years, and I believe that'll make me the oldest panelist on tonight's program. I think the most important thing I can tell you about my career is that, yes, it's taken me to a lot of places, some out of necessity and some out of just want. I've worked across Western Canada as a neonatal intensive care nurse for about 30 years, and also travel nurse for 5 years in the US as a neonatal intensive care nurse. Travel nursing was done after I'd already been nursing for about 25 years. I had to go and take the US exam at that time because it wasn't included in our nursing exams when I graduated back in 1977. So it was quite a uphill climb for me to get to that point to go travel nursing. And by then my son was grown and I was a single mom. And so off I went and had 5 years of amazing experiences, not only traveling and seeing the country of the United States, but also just learning so much from different hospitals, different parts of the country, how they do things differently, how much advanced they are, or how much advanced they're not. And it was just an amazing learning experience for somebody who had been in the same neonatal intensive care for 20 some years. And, you know, it's just never too late to learn something new, even in the same field. When I came back from the States in 2004, at the end of that year, I decided I wanted to have a bit of a change. I had taken a lactation course while I was in California, and so I did some lactation education as well as lactation consultant work on the maternity ward in Saskatoon. And then I switched over to something completely different. I went to recovery room. I was getting older, my back was getting sore, the 12-hour shifts were becoming too much for me, and recovery room was 8-hour shifts, so that worked out quite nicely for me. Then I decided another change after a few years and went to home care just on a temporary assignment, thinking that, you know, this would just be something temporary and I'd go back to recovery room. But in less than 6 weeks, I fell in love with home care and just loved the autonomy of it. You meet in the morning, you get your client list of who you're seeing and what you're doing for the day, and off you go. It's not to say that you're just out there and left hanging to dry by yourself. There's always somebody at the end of the phone that you can call at the office, or your co-workers who might be down the street or a few blocks away or a few miles away that you can call for advice or even to come and physically help you. Home care was another huge learning curve for me because it was, you are completely, you know, on your own at the moment you walk in that door. You never know what you might find. You might be going there just to give out medications and find somebody on the floor. Or you might be going to do a dressing change and find out that they haven't been taking their medications because they aren't remembering and they're starting to have some dementia problems. So it really requires you to be on your toes and recognize all kinds of things other than what you're just supposed to be there for. Since in the past year, I've had some health problems and have been off work. And I'm really excited to say that at the end of this month, I am not going back to home care, but I'm going to go to contact tracing for COVID. And I'm just very excited because that's going to be a whole new thing for not just me, but as you know, for all of us. And I just feel like I really want to try and do something for the pandemic, but because of my health problems, I'm very high risk and can't be out in the community doing nursing care. And so after 43 years now, I've come a very, very long way. And I can honestly say that nursing has been so exciting for me in many ways, but it's also really honestly saved my life in many ways. As a single mom with a small child, it was a very beneficial pay. Financially, I couldn't have been a single mother very easily if I didn't have that better paying job. The job took me to places I wanted to go, and when I needed to go to something else, I went to something else. There was also always another door that I could open and go through and still stay interested and excited about my job. And if I didn't want to do 12-hour shifts, I went to 8-hour shifts. I've even done 4-hour shifts at home care and in neonatal. I've gone to non-hospital jobs. I've gone to private home care. I've sold medical supplies for a short period of time. There's a lot of things you can do with a nursing background, and it's really been the most wonderful career for me. And I am in my late 60s, and I'm still valuable. There's still something I can do, even though I can't physically do nursing. I can still use my brain to do something helpful for our population and our families and friends. So thanks very much, nursing. It's been great. Thank you.
Thank you so much, Lorna, for sharing your story with us. I always enjoy hearing your journey. You've had so many different paths throughout your career as a nurse, but it's amazing for the students to hear the different roles you've had, where nursing has taken you, and especially how important it is to continually learn as you grow through your nursing career. Next up, we are going to welcome one of our nursing students to the panel. Peyton Humphries is a third-year nursing student in the SCBSN program in Saskatoon and is currently involved in the fast-tracking program with anticipated graduation in August of 2021. She is 20 years old and from a small town in southeast Saskatchewan. Outside of nursing, she enjoys taking care of her many plants, visiting friends and family, and practicing acoustic guitar. So please welcome Peyton Humphries.
Hi, everybody. So just to start, I was accepted into the U of S, the U of R, and Saskatchewan Polytechnic here in Saskatoon out of high school. I ended up choosing the Saskatchewan Polytechnic program for many of the reasons already said. You go directly into the program. It is incredibly hands-on. And since being in the program, I'm so happy with my choice. The instructors are absolutely phenomenal. They become your friends, they become your coworkers, and they're there to watch you succeed. Any questions that you have, you can go to them. They are honestly just amazing. Throughout the program, I'm in peds right now. So I've got to experience peds labor and delivery, surgical, medical, long-term care, and I've come to realize that nursing can take you anywhere. When I first graduated from high school, I really wanted to go into nursing to do my pre-med degree. Since coming into nursing, that has definitely changed, and I want to continue going into nursing and go for my nurse practitioner. Overall, with Sask Poly and just in nursing in general, I have made so many wonderful connections with, as I said, faculty, friends, and many patients. You built such a sense of community, and you just learn how to educate and communicate like you never thought you could. Nursing has been a really big confidence booster for me, both in my personal and professional life. I find that my communication skills have really upped their own game, and I'm so excited to just keep on going and elaborating on that. There's so many ways that nursing can take you. And honestly, if you get bored in one, after a year, you can go anywhere else in the world that you want. There's travel nursing, which I personally am interested in. And there's also community care, there's hospital care, anywhere. One of the biggest things for me in nursing school was definitely the fear of the dropping of the grades. So I want to tell you guys, your grades in high school are super important. Your grades in university are very important. But the main thing to remember when you're in this program or any program is that the competence that you have and your skills and your abilities means so much more than grades. So obviously you still want to strive for those good grades, but you don't want to let that compromise your life. I've known lots of people who have dropped out because of the stress, and there's just so many resources out there to help you. As I said, the faculty is out there to help you. We have fantastic free services such as counseling. We have people who will look over your essays for you. Just like all the resources that you possibly need to succeed are available at your fingertips if you access them. And lots of people don't. So I really encourage you to look at those and to utilize those. Particularly with fast tracking, I'm doing the August exit. So I'll be done my degree 3 years from when I started in September of 2018. So that does give me a leg up with getting a job, hopefully. And it also allows me to keep that information fresh as I go. So that is one option. And as Sheena said, there's also a December option. So that's 3.5 years. And another option that wasn't mentioned was if you're just feeling like the stress is too much, or you need a break, or you're a mom or a dad, you want to work part-time, you can also go out of cohort and do a 5 or 6 year program. So it is very versatile and they're willing to work with you. That is pretty much it for me. So thank you very much for having me.
Awesome. Thank you so much, Peyton, for sharing your journey with us throughout your post-secondary experience at Saskatchewan Polytechnic. And it's great to hear your words of advice for the future students who are thinking about going into the program, and also to hear the different resources that are available for the students, because a lot of times when students transition from high school to post-secondary, they don't always realize that there are still supports in place for them. We are going to move on to our next panelist, Leah Bosher. She has been in healthcare for 15 years. She started in housekeeping, then took the sterilization technician course and worked in SPD and the OR as an attendant. She went back to school at the age of 40 for her LPN and worked on 5A surgery at St. Paul's Hospital and a surgery floor at the Saskatoon City Hospital. She then worked at the Women's Health Center and ambulatory care. She is presently in the perioperative program heading into the operating room. She loves to travel and has been all over the world. She loves culture and learning new ways of living and cannot get enough of the outdoors, and loves to garden with the belief that whole food is our medicine. She has a strong belief that it is our responsibility to leave people better off than we find them by what we do and what we say. So please welcome Leah.
Thank you, Michelle. Thank you for having me on tonight. Like was said, I'm currently a student and I have 6 days left until I'm finishing off this 11-week clinical rotation for the perioperative program. And after that, I'll be working in the operating room as an operating room nurse. What does an operating room nurse do, you may ask? Well, there's a scrub nurse and there's 2 circulating nurses that are usually in the room. And when you're a scrub nurse, you're actually scrubbed right in with the surgeon and many of the cysts that attend with the surgeon. You're handing instruments, retractors, sponges, sutures, etc. up to that surgeon. You must know the surgeries, be able to anticipate what that surgeon will need, and you must know all the names of those different instruments that are being used. If bleeding occurs or an emergency occurs on the field, you must be very fast at getting proper instruments up to that field and also using homeostatic agents to stop bleeding. That surgeon relies on you. You must be fast at doing it. Also, you can be a circulator nurse, which means you'll admit the patient to the operating room theater. You'll make sure that there's certain equipment that the room needs and that there's certain positioning that each patient needs for different types of surgery. You have to have a knowledge base of that. And also you get to help anesthesia, either get a spinal in or get that patient off to sleep. So you're actually assisting in those duties. And then the other circulating nurse is helping the scrub nurse by opening up packages to that nurse to the sterile field. So it's quite an exciting routine and a place to work. And because these surgeries are elective, meaning that they are booked in advance, you work 8-hour days Monday to Friday, but you also do have a call rotation, meaning that you might be on call at night. You might be called in at 1 or 2 or 3 o'clock in the morning from people coming up through emerge. And then you coming in to the OR, you have absolutely no idea what's coming through that door. So that's kind of the out of the ordinary for the core, or for what you're learning, which will be very interesting to be a part of. So as was said, my career path started a little bit older for me. In 2006, I started in housekeeping, and then I went to SPD. Then I worked in the OR as an OR attendant, and I thought, well, why am I not just becoming a perioperative nurse? It was all very exciting to work with surgeons and anesthetists and nurses and see these surgeries firsthand. And then I found out you got to be a nurse first. And I wasn't. And I was a kid who grew up in the 80s, and I didn't really take school seriously, to be honest. I graduated, but just barely. My grades sucked. But I went back to high school anyway. Needless to say, at night, I worked during the day in the operating room as an OR attendant, and I applied for nursing, the LPN program, for 3 years in a row, and I was rejected every single time. But one day I decided, you know what, I think I'm okay with just being an OR attendant. And the minute that I decided that, I got a phone call, and I was accepted into the practical nursing program at Great Plains College in Biggar. And I drove for 2 years to take that course with 4 awesome young ladies, and we got that course done. It's recommended after you become a nurse, if you want to go into the operating room, that you be a surgical nurse on a surgical floor for 2 years first. So I did that. I worked at St. Paul's and City Hospital, and I applied for the OR course, and again was denied for about 2 years. I didn't get in, but I just kept applying. And finally, I did get a phone call that I was accepted into the course through Polytech. And even to my delight, I'm very happy to say that the health authority paid for that program for me. So I'm very happy that I got that. And I'm very appreciative to the health authority for that, for making my dream come true and not having to pay for that. But I will be in service, so I do pay for it in some way. Why I chose a specialty, the OR is fascinating. Surgeons are fascinating. Anesthetists are beyond knowledgeable, will teach you many incredible things. And fixing broken people. It's absolutely amazing and jaw-dropping, the things that you're going to see in the operating room and how surgeons and the whole team come together to make that person better. And I really love being a part of that. I guess I have one thing to say. Nursing definitely isn't like Grey's Anatomy. It's not you standing around developing a relationship with people all day long. You're working shift work, you're on call, you work 12-hour shifts. Sometimes you'll work 3 or 4 12-hour shifts in a row, whether they be days or nights. Some rotations are like that. You need to be a person that takes some initiative, be hardworking because you're on your feet all day. I highly recommend nursing because you'll always have a job. There's always somewhere to go. You can work in different capacities in different areas. If you don't like one, you can try another. If you work in peds and decide you don't want to work with kids anymore, you can work with the elderly. If you don't want to do that, you can work on a surgery floor, medicine, go to the OR. There's lots of incredible opportunities out there for LPNs, and I really had a great 4 years already doing it. I'm really happy that I chose to go back to school, even though it was later in life. You're always learning new things. Expect to be a lifelong learner. It's never stagnant. That's the exciting part about it, is your brain is always keen to learn new information. So all I can say is if you really love people and you love being a part of a team, this job is definitely for you. Thanks.
Thank you so much, Leah, for sharing your story with us. And it's inspiring to hear about your persistence and how it's paid off and getting into nursing and now getting into the program you're in. And what you said about nursing being a career where you have to be a lifelong learner is very true. And I hope the students with us tonight are understanding that and seeing that through all of our panelists, how passionate they are about their career and how excited they are to continue to learn and grow in their roles. We have another nursing student joining us. So next up we have Taylor Cave, and she is a second-year practical nursing student currently in a rotation at Saskatoon City Hospital in surgery. She is from Battleford, Saskatchewan, and in her free time, she enjoys hanging with her new puppy Baker, playing slow pitch, and going to spin classes. This year has taught her a great deal about adaptability, and she believes any nursing student learning how to manage this profession during a global pandemic will only benefit from it in the end. So please welcome Taylor.
So hi everybody, I'm Taylor. I actually just finished my third of 3 12-hour shifts on surgery here. So I just got shoved in a room that doesn't get used at the end of the ward, so that's okay. So my journey to nursing, similar to what Trudy had mentioned before about the U of S pre-professional year, I applied to U of S right out of high school. Was thinking nursing was cool, was thinking kinesiology was cool, so I just went into arts and science to kind of see what I wanted to do. Turns out I just wasn't really committed to school. High school came pretty easy to me. My marks were always good. I would study, but not study crazy. So going to university was a big eye-opener. I had a lot of friends in the city, so I ended up going to all the parties. I lived away from my parents, and midterms came around and my marks were just not awesome. I was used to high 80s and university, low 70s, high 60s. It just doesn't feel good. I would study nothing crazy, and I found out that post-secondary you need to put the time in to get the grades. And then after my first year, I was disheartened. I didn't like my grades. I didn't know what I wanted to do. So I didn't go back the following year. My best friend and I were kind of on the same path, I guess, and we decided to just work. And then we were gonna go traveling. So I worked and got my first job as a care aide. I got a continuing care aide position in Battleford at a long-term care home there. Worked there for 7 or 8 months, and then I went traveling to Southeast Asia for 6 months just with my backpack and my best friend. And that was the best decision I ever made. I traveled for 6 months, lived in hostels, had no set plans. It just kind of was refreshing to me after being so stressed the first year. I learned so much about myself and what I wanted to do. And then so the following year I applied into both the registered nursing program and the practical nursing program, but I didn't get accepted. So I was naturally crushed. I didn't know what to do. So I just kept working as a care aide. And I took some classes while I was working. So some of the classes I took directly transferred into the practical nursing program, and they also helped boost my average a little bit. So I took anatomy and physiology, I took some sociologies, and I already had some previous classes from the U of S that helped me too. So after that, the next fall, so last fall, 2019, I got accepted. So that was my first year of the practical nursing program, and here I am now. The difference from my first year going to the U of S being 18 versus now, I was 23 when I started the program, is once you're committed to something that you genuinely love to learn about, like I love learning about the physiology of things, the medicine of things. I love seeing how the connections are made and how everything just makes sense. And when something's not right, you have to try to get it all to mesh and make sense. So that part of it, I wouldn't say obsessive, but partially. And then, yeah, similar to what Peyton was saying about the confidence booster for nursing, I was always a really athletic person. I always had like a leadership role in my athletics, and that definitely helps in nursing. And with the confidence boost that you get out of nursing, even just something like this, I used to hate talking about myself or hate telling my life journey, and I find it very helpful for people thinking about joining nursing and joining this wild profession that we're all a part of. And what else about Sask Poly? The resources are really great. Peyton mentioned that. I often, well, more than often, use learning services to send my big essays and papers to. They'll pick out little small mistakes and make recommendations for you, which is super awesome. The practical nursing program, the small class is really nice. I know every single person on a personal level. You get to know everybody. I managed to pull a best friend out of the program, so that's pretty sweet too. My future plans for nursing, I want to work for a bit. I'll be done my preceptorship here in June of 2021. So I want to work for a bit and not be a broke student for a little bit. And then I want to apply into the upper year admission for the bachelor's program eventually. Not too sure when, probably apply, see how things go, but definitely get some experience under my belt and then see where that goes. Yeah, I think that's it.
Awesome. Well, thank you so much, Taylor, for sharing your story with us. And it is, as much as sometimes parents don't like to hear stories like that, it is good for students to understand that if you don't know exactly what you want to do leaving high school, or if you decide to change your mind somewhere along the way, that's okay. No one's career journey is a straight line, and sometimes they take some twists and turns along the way. And there's no such thing as wasted learning, because what you learned in your first year of kinesiology and arts and science probably helped you in your schooling now in nursing. So there is no such thing as wasted learning. It's okay to change your mind. It's okay to change your path, and hopefully it will get you to where you're happy. And it sounds like you are in a position where you are happy in nursing, and we're happy to hear that. Our next panelist is Lindy Ooms, and she graduated in 2016 from the University of Saskatchewan with a Bachelor of Science in Nursing. She worked her first year in long-term care before accepting a permanent full-time position in the NICU. Linda has worked in the NICU for 3 years and loves her job. She loves the combination of acuity and family-centered care. And in her free time, she enjoys playing with her 2 dogs and crocheting. So please welcome Lindy.
There we go. Hi, everyone. Thanks for having me. So yeah, like I said in the introduction, I've been a nurse for 3 years in the NICU, so neonatal intensive care. I absolutely love my job. It's a good mix of the stable kids and the acute sick ones. There's lots of learning opportunities even within my unit. I'll tell you a bit more about it. I feel NICU isn't all that well known by the public and everyone. I certainly didn't hear about it really in nursing school. My sister works there as well, so that's kind of how I found out about it. So we look after preterm kids, so less than 35 weeks is usually what we'll get. Full term is a 40-week baby. And we'll take care of very sick kids as well. I did my 4-year nursing program at the U of S, and then NICU also has, I think it's 10 weeks of intensive like classroom and buddy shifts. And it's broken down into levels of training even after that. So the first kind of level is our feeders and growers, we call them. They're just preterm kids. They're usually off respiratory support, and they just need to work on bottling and growing, really. The youngest we'll send them home is 35 weeks. So that's those guys. And you'll also look after stable vents in that area, so intubated babies but they're not all that sick. The next level of training is, we call it a Rover Nurse, so that's what I do. I go down to deliveries both in C-sections in the OR and vaginal deliveries with mom, and help resuscitate baby if they need. And you also look after the very sick kids. So I'll kind of go into that. That's cases I've never even heard about in nursing school. So just coming onto the unit, it's a very specialized area of learning. So first one is micro-prems. So we classify that as any baby born under 26 weeks. The youngest one I've ever looked after is 24 weeks, and they were 600 grams, so about 1.5 pounds. And just to give you perspective here, like this is a newborn diaper, and this is the micro-prem diaper, the little tiny ones we look after. So we look after micro-prems. Gastroschisis is another one we look after. So that's a baby with their intestines on the outside. So we take care of that. We put the intestines back where they should be, and they have surgery for that. So we look after those kind of kids. We also look after what's called a diaphragmatic hernia. So the baby has a hole in their diaphragm separating their lung space and their intestines. So a hole in diaphragm is the intestines go up into the lung space for the baby. They need to have surgery for that as well. And we also look after heart babies. So abnormality in the heart, we can look after that. And if they're really sick, we'll send them to Edmonton for surgery for that. So that's kind of where I'm at in my training right now. There's also charge nurse training, of course, and you can even do even more training to be a transport nurse. So a transport nurse goes all over the province in a plane with a respiratory therapist, and they pick up the sickest babies in the province and bring them back to us. Saskatoon takes the sickest babies in the province, and like I said, sometimes we'll send our heart kids to Edmonton, but Saskatoon is where we look after them. Regina also has a NICU, PA has a NICU, a couple other, of course, places deliver babies, but the sickest ones all come to us in Saskatoon. So that's kind of NICU. My day-to-day is coming on shift. I get reports. I do my safety checks for the day for all my babies, so making sure the resuscitation equipment is set up there. And we assess our babies every few hours, just depending on how stable they are. And they're always on a monitor, so we know their heart rate and their respiration rate, all that, all times. One thing I would recommend if you're coming to NICU is you be very strong at math. We do lots and lots of math every day, every hour. It's checking your IV rates, your oral meds, medications is all double checked with another registered nurse. And you work very closely with respiratory therapists, nurse practitioners, the doctors. It's very intricate and well cog machine. Pretty cool stuff we get to do as a NICU nurse is we help with intubation. So as the nurse, you're responsible for giving intubation meds for the baby, and once the tube is in place, you listen and auscultate and make sure it's in the right spot. So that's pretty cool. We also help with, we call it line insertion. So like a big IV or like a PICC line. We also do umbilical lines. So with the baby's umbilical cord, there's an artery and 2 veins. So we can insert a line in there and give them fluids and IV medications in an emergent situation. So that's pretty cool. You get really good at IVs, that's for sure. Like IVs smaller than the strand of spaghetti, like they're itty bitty. So you get good at IVs when you work in the NICU. Yeah, that's kind of my day-to-day. I absolutely love what I do. I love seeing the 24-week babies grow and get their chubby cheeks at 35 weeks and finally get to go home to mom and dad. It's really rewarding, and it's also very challenging. The good days are good, and the sad, tough days are extremely heartbreaking. But I feel very passionate about what I do. And I love that connection you get with the families. They remember you and the stressful time that they're in their life. And it's always nice to have them recall that you were the nurse that did this thing for them or this little thing. And it's may not seem like a big deal to you, but it's a very important moment for those families. And I just love being a part of that. So that's all I really have to say. It's thanks for having me.
Thank you so much, Lindy, for sharing. Your passion is very evident for what you do. And once again, it seems we have a recurring theme throughout the night, which is that nursing is a career where you are a lifelong learner and you're continually growing as you evolve throughout your career. So thank you for sharing with us. Finally, our last panelist of the evening is Juliana Mussolini. She is currently finishing up the final year of her Bachelor of Science in Nursing at the University of Saskatchewan. She has a passion for the nursing profession and hopes to work as a medicine and surgical nurse at St. Paul's Hospital. Eventually, she hopes to pursue her Master's of Nursing in Nurse Practitioner. So please welcome Juliana.
Hi everyone, good evening. I'll try to keep it short since I'm the last person to speak. I'm super honored to be here, so thanks for having me. I'm Juliana and I'm a fourth year nursing student. I'm doing my Bachelor of Science in Nursing through the University of Saskatchewan. So I will be finishing up here in March. I'm super excited to be finished during this hectic time in the pandemic. So I was once like a lot of you guys. I was in high school, not really sure what I wanted to do or like just trying to feel out lots of different careers. I graduated from Bethlehem High School here in Saskatoon in 2016, and I entered arts and science at the U of S. I actually took 2 years of a physiology and pharmacology degree. I knew I wanted to work in healthcare. I just really wasn't sure where or what kind of discipline. I thought med school, pharmacy, physio. I couldn't decide. And I never really considered nursing until fast forward, I went through something really tragic in my life and my friends were in the hospital and it was crazy to go visit them. And I was just amazed by these nurses and like the level of care that they could provide and the grace that they brought to my friends, their family, and me. And so it kind of just clicked for me, like these nurses changed my life and it clicked for me, like I want to be that person for someone else. I want to be impactful. I want to be purposeful. And so here I am through the past 3.5 years as a nursing student. I can say that I've been that person for a lot of people. You're there through highs and lows. And it's really quite purposeful to be in that position for people. And while being an undergraduate nursing student is very challenging, it was challenging to get into the program. It's challenging throughout the program. I'm sitting here in my last 3 months of school and I can tell you it is so worth it. It is so worth it. It really pays off. This profession is so diverse and it has so many different opportunities embedded into it. Nursing, again, has given me purpose and passion. I've felt this with so many interactions with patients, and you can truly change people's lives. I've also established so many awesome relationships with not only patients, but their families, as well as other nursing students and other coworkers that I've come across along the way. Earlier they had kind of mentioned continuing care aides. So I've also worked as a continuing care aide in a long-term care facility here in Saskatoon called Sherbrooke. And now I've done that for the past 3 years while I was in nursing school. I would strongly recommend doing this if you plan to pursue nursing. It'll give you so much experience for this profession and it will prepare you for this, the communication skills you need to have in this profession. It also looks really good on a resume and it gives you the upper hand when you're trying to apply for a job at the end of your degree. It gives you kind of you're internally in the system, so it's a little easier to get a job. So yeah, I'm from the U of S, so I'll just speak a little bit about that. The U of S was amazing for me. The professors, while it is a bigger classroom setting, the professors were so intelligent and so supportive. I got to know pretty much all of them individually and on a personal level. And when I had some things going on in my own life personally, they were so accommodating and there for me. And again, there were also those external supports in place through the College of Nursing as well as the U of S. So there is always people there in your corner. So I highly, highly recommend the U of S. And I was so fortunate with my clinical experiences. I got to go to long-term care. I got to go to labor and delivery, postpartum, medicine floor, surgery floor. I got to go to the OR, mental health, corrections as well, and a cardiology unit, and as well as a school setting. So that's a lot of different places. So as you guys know, there is so many diverse areas you can go into with nursing. And so in my own learning, I had opportunities to do direct observation training, which is the step down from ICU. So really acute patients, just kind of not quite at the ICU level. So I had that kind of training as well as like regular ward training. So I feel pretty well prepared to enter this profession during a pandemic, which is great. So if you are ambitious and you want to continue learning your whole life, and maybe you're someone who's kind of like me, who is just kind of all over the place and not always really sure what you want to do, nursing can be for you, because there are so many options for you. You know, you look at any nurse, like how you see Lorna is an amazing testament to this. Like, if you look at any nurse's resume, it's probably 10 pages long at least, because, you know, you can just keep trying new things. You never have to feel hunkered down to one job. And I mean, if you find that job you love, you can stay there. It's amazing. So, yeah, I don't really have anything else. Oh, and one thing I wanted to mention, just along with the support of the college, there is scholarships as well through the U of S and through the College of Nursing. And I was really fortunate as like a single student paying for a lot of my own stuff. I actually received like over $5,000 in scholarships to help with schooling this year alone. So there's always supports financially as well. If you can achieve and apply for those scholarships and take the time to do that, please do that, because it can really pay off in the end for you. So I just thought I would note that. But yeah, thank you so much for having me. I don't have anything else, but if you have any questions, please ask.
All right. Thank you so much, Juliana, for sharing your experience. And once again, another reoccurring theme is that your post-secondary pathway is not always a straight line. And so you changed your mind. You didn't know what you really wanted to do, but somehow you found a path that really is suited to you and your personality, and you're entering into a career now that I personally think you're destined for. So thank you to our panelists. We are going to have Q&A now, and I am trying to pay attention to the chat and the Q&A going on. And I don't see many questions. I think that some of our panelists either addressed questions throughout their talks tonight, and I know some of our post-secondary panelists have been answering questions in the Q&A. But if anyone does have any questions, then just shoot them into the chat or the Q&A, and we'll get those answered for you before we wrap up here tonight. I'll give you a minute or two, but not seeing anything coming up. All right. Well, I hope everyone had their questions answered throughout tonight. I know Sheena and Trudy have been in contact with some people through the Q&A. Be sure to reach out to them. Their role is to help students and their parents who have questions if you are thinking about entering into one of their programs after high school. So make sure you reach out to them, let them know that you were part of this event, and ask them any questions you may have. So if there's no questions, I'm going to wrap things up so everyone can get on there with their evening. So thank you for attending our event tonight, and I want to thank our partners who helped put this together. So we partner with the Saskatchewan Health Authority for this event, and in particular, I would like to thank Lauren Garner and Alicia Robb, who both were instrumental in putting this event together tonight. I want to thank Saskatchewan Polytechnic, the University of Saskatchewan, and the University of Regina for sharing their important information with us tonight, as well as Greater Saskatoon Catholic Schools, Saskatoon Public Schools, Prairie Spirit School Division, and the Saskatoon Tribal Council, who are our partners. Thank you to my colleagues who helped put on this event and make this event happen for you this evening. And finally, thank you to everyone who tuned into the event tonight. We are happy to put on events like these throughout the year, and when you guys attend them, it really makes them that much better when we have the questions in the chat and the Q&A, and it really helps guide us. So thank you for being here with us. I do want to encourage you to give us feedback. So we are funded by the government, and they like to know what we have going on, and we like to know what you liked about our events and what we can do better in the future. So I do want to encourage all students who attended tonight to give the QR code a scan. I swear it's only a few minutes. Give us your feedback and let us know what you thought. Anyone who does give us feedback is entered in a draw for some prizes. So I do encourage you to take a few minutes and give us some feedback. I also want to encourage you to take the opportunity to map out your career journey. So maybe tonight you were here and you heard about nursing and it either pushed you in that direction or maybe it pushed you in the opposite direction. And like we mentioned earlier, finding out what you don't want to do after high school is just as important as figuring out what you do want to do. So we are hosting events similar to this every month. So in October, we highlighted careers in science and technology, and in November, we looked at careers in manufacturing and mining. So if you missed those live events, we have recordings on our website, so be sure to check those out. And in the coming months, we will be looking at different areas, and in particular, in January, we will be looking at mental health and wellness. So maybe you realize nursing isn't the healthcare career you're interested in. Well, we will be looking at other healthcare related careers as well. So be sure to check out our website and see the different programs that we have going on. And lastly, the best way to stay up to date with everything going on at the Saskatoon Industry Education Council is to follow us on Instagram, Facebook, and Twitter at Saskatoon IEC. So give us a follow, stay up to date, and we hope to see you at some of our future events. Thanks for joining us and have a good night.